Lawmakers are debating what would really happen if Idaho repeals Medicaid expansion, including what's at stake for federal funding and who would ultimately bear the cost. I'm downtown Boise neighborhood reporter Riley Shoemaker, and I spoke with lawmakers as the issue resurfaces this legislative session.
It's the largest single budget within the state of Idaho.
It's the most cost-effective, program that I believe Idaho has.
Competing views within Idaho's State House highlight a larger disagreement over whether Medicaid expansion is controlling costs or driving them. At the center of the discussion, Medicaid expansion, approved by Idaho voters in 2018 and now providing healthcare coverage to roughly 90,000 Idahoans. Lawmakers agree the numbers involved are significant, but disagree on what those numbers actually mean for Idaho. Republican Representative Josh Tanner says Medicaid expansion was designed for a specific population.
Medicaid expansion, no matter what you look at, if you look at it from just a job aspect, these are able-bodied working adults. These are the people that are supposed to be out there working.
Tanner argues the program has grown faster than expected, putting pressure on the broader Medicaid system.
Should we be cutting children for able-bodied working adults? Should we be cutting the disabled for able-bodied working adults? I think we need to go back to the focus of who we want to actually focus on.
Democratic Representative Megan Egberts says Medicaid expansion has done the opposite, helping Idaho manage costs while covering people who otherwise fall through the cracks.
Medicaid expansion is one of the best choices financially that our state has made.
Egberts says repealing expansion would not eliminate the need for care. It would simply change how Idaho pays for it.
If we repealed Medicaid expansion, that 90%, which is over $1 billion of funding, goes away. But the healthcare needs of those 90,000 people do not go away.
Tanner points to recent provider rate cuts as a warning sign that Medicaid costs are already affecting care statewide.
We saw a 4% cut. That didn't matter if it was dealing with children. That did not matter if it was dealing with disabilities.
But Egbert says without expansion, hospitals would still be required to provide emergency care, and those costs don't disappear.
People with private insurance will pay for it.
Budget analysts note Medicaid funding is not a fixed pot of money redistributed between states. If Idaho repeals expansion, the state would stop receiving federal matching funds tied to the program. So those funds would not be earmarked for Idaho and would remain subject to federal budgeting decisions.
So as the session kicks off next week, lawmakers will decide whether or not to hold on to the voter-approved program. I'm downtown Boise neighborhood reporter Riley Shoemaker, Idaho News 6.